how you feeling these days?
Oh, I'm feeling great.
Yeah.
You know?
Mr. Frias had an injury playing softball, where he was running full speed around a base.
And I was coming around second, and I looked, the ball sent past. I'm like, okay, I can make it to third. And then I started taking off to third, and about 3 steps out, I took a step down, and I felt a snap, and I heard a snap.
The Achilles tendon has sort of a weak spot where it doesn't have great blood flow right behind the ankle joint. And that's sort of the weak area of the Achilles. And so when patients sometimes are running full speed, it puts a lot of pressure on the Achilles, and sometimes it's just one instance is enough to cause the Achilles to rupture.
Felt it snap, and I went down like a sack of potatoes. Then I tried to stand up and like maybe put a little weight on it, and I went back down, and right away I knew it was my Achilles.
It happens primarily in these weekend warrior type athletes. So it's typically men between 40 and 60 years old, and it happens with bursts of speed running. So softball, tennis, basketball are sort of the common places we see it. But we do see these workplace injuries too, where people are running. We can see these in situations of trauma when the tendon fibers actually tear apart. They can be treated very successfully non-operatively with a functional rehabilitation protocol, and some patients would benefit from a surgical repair. It has been shown that patients who have surgery have a faster return to playing competitive sports and a faster return to work.
When I first saw Dr. Schiff at Loyola, I expressed to him that I was really interested in a really non-invasive surgery, and what he told me is he had a new technique. Instead of going a vertical scar, he would go horizontal.
With repairing the Achilles surgically, there are a couple different ways. The traditional way of repairing it is with a vertical incision, finding both edges of the tendon and sewing them together. But there are some new techniques that allow us to make a much smaller incision. It can be horizontal, which is my preferred method. We're able to find the rupture of the tendon and pass a tool or a device underneath the skin to grab the tendon. We're able to pass sutures from outside of the skin through the tendon and back outside. And this device allows us to pull those sutures through and to tie them. The advantages of the smaller incision is it's obviously cosmetic, it's a much smaller scar. But one of the complications we see is the ability for the scar to heal. And if the scar doesn't heal well, then it almost negates any type of rehab that a patient can do. One of the most important things after the surgery, whether it's done minimally invasive or done the traditional way, is a very strong functional rehabilitation protocol. And through our team approach with our physicians, our mid-level providers, our physical therapists, our athletics trainers, we're able to get patients in this therapy plan and keep them in this therapy plan and keep them moving in the right direction.
I went to physical therapy, and they gave me a lot of direction, a lot of exercises, so I can build up the strength in my ankle to support my Achilles. I feel like I'm in better shape now, and I know I'm in better shape now than before the accident.
One of the things that's important about this is getting patients diagnosed quickly, and through our emergency room, or through our primary care physicians, through our athletics trainers and physical therapists that we work with, patients with this injury are recognized very quickly, and we're able to offer them prompt surgical treatment.
My mobility is phenomenal. It feels really good. Wouldn't have wanted to do it anywhere else but here. Come to Loyola, and Dr. Adam Schiff, he's the pro at doing this, and I don't wish it on anybody, but you know, if it happened, I would definitely tell them to come to Loyola.